Hi guys, Dr. Anjana Bhana here and welcoming you back to my channel after a short break. And today I am super excited to show you something different. So it's not skin, it's hair. So we're going to do a hair rejuvenation treatment or multiple treatments actually on Beverly, and it's going to be really cool to see. The thing with hair is, and it's different from skin, maybe you'd see a result on the first session, a slight result. Skin, you'd see something almost immediately when you do a peel or you do a skin boosting treatment, but hair requires at least 3 or 4 treatments spaced 2 to 4 weeks apart for like a meaningful satisfactory result. But I'm super excited to go through that with you. And we have the beautiful Beverly here, and people probably recognize her. Bev is our patient concierge and front desk manager. She's the friendly face you see when you come in, and she is a very needle nervous lady. But thank you, Bev. Lots of needles today, but I know you'll be fine. Bev's had other treatments with us, so I know she'll be fine. So in terms of what we're doing, we've already had the area numb that we're going to work on, and Bev's very concerned about the hairline, and this is called this sort of hair loss in this area is called traction alopecia. So it's from having your ponytail too tight, so stopping the blood flow and then having a bit of loss of hair there, or having very heavy braids. So that sort of treatment, once those heavy and tight hairstyles are stopped and we start rejuvenating the area, getting some blood flow and growth factors into there, you often get a really good result. So there's lots of different causes of hair loss, and some are very easy to be treated. Some have an underlying cause like vitamin deficiencies and irregularities with your hormones. So first treat the cause, and then you can do these sort of superficial treatments. So most importantly, we want to stimulate and irritate the scalp, so we get those follicles growing. And what I'm going to do now is something a bit innovative. It's actually placing threads into the area. These are mono threads. They'll last about 8 months, and while they're there, they're stimulating and irritating the scalp, so Bev will get some hair growth. We're also going to do a growth factor, like a specific for the hair. So 2 different methods of infusing it in, and then a high frequency treatment as well as an LED light. So different light frequencies stimulate different cells, and then we're going to check in with Bev I see you every day, Bev, so I'll check in with you every day, but in about 4 weeks time we'll repeat the treatment, except the threads. You don't have to do that because, you know, that's like 6 to 8 months you're good. Okay. So we've applied a topical lidocaine here. You can also inject and do a block to numb the area, especially if it's extensive or a full scalp treatment. But most patients do fine with just topical anesthetic or no anesthetic. Okay, so return to the side for me. So if you can see, Bev's hairline should be there, and so that's where we will put the threads. Still okay, Bev? Okay. You ready? Yes. Okay. There we go. If you turn to the side. So this vibrating device can be used if you suspect some discomfort, and it helps to distract from what's happening. First thread in. Was that all right, Babe? Yes. You think you can do another 4 on that side? So the threads we're using, you can use thicker threads, a 31 gauge PDO threads, because the sharp needle threads versus, you know, some of the ones I put in the face, those are on a blunt cannula. With sharp needles, doesn't matter how thin they are, there is a risk of bruising with them. So, and the scalp area is vascular, so it's important to ice. You can use a arnica gel rub, and it would be nice to have an assistant to hand you the hands, but it's fine. So if you guys don't mind me turning around constantly to get them. And Bev's obviously fine because she's laughing. Are you fine, Bev? Or are you just laughing?
100%.
Nervous laugh.
No, it's not so.
And why threads? You know, it's because the constant stimulation's there. So say a patient is a very busy patient and might not be able to return every 2 to 4 weeks for a hair rejuvenation. It's a nice option that you can give them where this stays in for a little bit and does its work. These threads are also nice in the neck, in the face. If I feel some resistance, I just pull out. We don't want to. If there's resistance, then the scalp is telling you something. So not to push it. So that's easy peasy. Those are the threads. And then we're going to needle in. And I'm also going to use a special needle called an SIT needle. It goes to the depth of the follicle to infuse what needs to be infused. So this is a hair loss solution from Meso Aesthetic. But what we also do for hair loss, we do PRP, PRF. There's something called hair filler. It's a Korean product. So it's usually very rich in peptides that stimulate the scalp. You can also use, I'm going to say Botox. You can use Botox, botulinum toxin, especially if the patient has a really oily scalp. It also helps. And there's something we love using from Fullmed that I'm going to needle in. That's also excellent for hair loss. But the thing is constant treatment as well as something to take home. So there's a lot of stimulating shampoos, serums. We have our own hair elixir that we apply afterwards and the patient can take home as well. So regenerating your hair is a process, but it is well worth it, especially if your indication like this, traction alopecia, is something treatable. And when you've stopped, like Bev's hair is pretty healthy and she doesn't wear very tight styles, so she'll probably get a really good result. So this is the SIT needle. It's like a really tiny needle in the center, and this stops it from going too deep. It creates like an equal depth every time you inject. This is really nice if people have long hair as well, because the needle, you can use a comb to part the hair, and it's very quick. It is normal to see a bit of like pinpoint bleeding. If your hair doesn't grow after this, then I don't know. After all you've been through today. And then here there's a little patch, so we'll go in there as well. Also, you know, recently, like it might not seem like I need hair rejuvenation, but I do, because I find that my hair is thinning, and a lot of people now with COVID, post-COVID, after a traumatic event, 3 months later, you usually find like some hair fall, some hair loss. So even if you don't have distinct hair loss, or you find you might be shedding more, or like me, you've just done 40 and everything is not okay, you know, you're going a bit downhill. It's nice to not only focus on your skin or your face, focus on your hands, focus on your hair, because we often forget those things. So it's really, really nice to have this sort of treatment, as you know, like to normalize hair rejuvenation, whether you have distinct hair loss or not. So baby, you turn slightly to this side. So the solution that we're using now is full of vitamins, amino acids, glutathione, minerals. And I know after treatments like this, if you go straight there, if you put your head straight for me, the scalp feels like you want to scratch it. I'll put something on for you now, so relax. And why keep the needle on as well once I've drawn up? It's not for injections, but it's just to control the flow of whatever we're needling in, because it's so liquid. If we don't, it'll create, it'll just run all over the place. In, and then we usually use this just to calm it down a little bit. Feeling okay? Yes. This is a little secret hair growth serum, but I think some aesthetic doctors out there know exactly what this is. And this is our hair elixir that we are putting in. And you only wash your hair the next day, but Bev's like, she'll wash it on, when we can wash it? Monday, 2 days, it's fine. But yeah, as long as you leave whatever we've done for a day, so don't go home and have a super hot shower. I mean, we've done so many things here, and it'll irritate the scalp, and you also want time for the elixir and all the things we've needled in to work, and all the little channels we've created also to settle down. So this is our high frequency device, and I always get a bit embarrassed to look at it like this because it is an embarrassing shape. So I was like, whenever I open the box, I'm like, oh, I hope the person doesn't see what this thing actually looks like. But this is really nice, and you can even get one for a home. But you know, all these home devices, I don't know about you, but it's not something like you buy all this junk and you never use it. So come see us rather. There's a gas that it heats up in here, and it stimulates the area, and you shouldn't feel any electricity or pain or shock or anything like that. Babe, you feel okay?
Yes.
Just stimulating the blood flow. There's different attachments to this. I was going to say heads, but like attachments to this, and it's really good if you are prone to breakouts as well. So it's nice and soothing post-treatment, because after needling and after all those injections, your scalp gets really irritated and itchy. So that's why you put all those things after. And then we do this, and then the patient has some relaxing time under our LED. Is that okay?
Yes.
Okay, I'm gonna pull it tight. Tell me, is that comfortable? Too
Yes.
tight?
No, it's fine.
Okay. Thanks again for joining me today and our beautiful Beverly on a hair restoration journey. If you like what you see, please like, share and subscribe. Any questions, comments down below. And thank you. Bye.